Hi everyone, I'm Dr. Flores. I'm one of the fertility specialists here at San Diego Fertility Center. Today I wanted to talk about the IVF stimulation process. So I know it can sound a little bit overwhelming because we give a lot of different timelines. So I really wanted to break it down just so that you'll get a clear understanding of the step-by-step process that goes into IVF stimulation and then ultimately having an egg retrieval. So after the initial consultation and after we get all the fertility labs and after we've regrouped, talked about next steps, which is going to be moving on to IVF, we then talk about something called a preparation month. So that is before we actually start the stimulation or the injectable hormones for getting the eggs to grow. There's a pre-step essentially. So we intentionally want to suppress the ovaries just a little bit with either estrogen-only pills or birth control pills. The rationale for this is if we just kind of said, let's go ahead and start stimulation meds today, what can happen is one of the eggs can get ahead of the others. It kind of, in a sense, likes all that medication, and then the other eggs are having trouble catching up. But the goal is to maximize as much as possible the number of eggs that we retrieve for you. So we place you on birth control pills or estrogen pills just for 2 weeks so we can help ensure that once we start the stimulation medications, all of the eggs will grow at the same pace. So how this will all happen is we will give you instructions to call with the first or second day of your period. That will then prompt a consultation with one of our IVF coordinators, and you'll get a detailed calendar outlining when you're going to start those estrogen or birth control pills, when you're going to stop those estrogen or birth control pills, again, usually around 10 to 12 days of those medications. And then it'll also have on the calendar the day that you're going to come in for what's called a baseline appointment. So that is the day that you're going to be starting the stimulation medication. So you'll come in for an ultrasound and blood work. The ultrasound's looking at the ovaries just to make sure that no egg or follicle has started to try to grow on its own, to count the follicles one more time, and then to really just finalize the dosing of stimulation medications that you're going to be on. Most times patients are on 2 medications. The generic names or the hormonal names are follicle stimulating hormone and luteinizing hormone. The trade names are Gonal-F or Follistim for the FSH, and then Menopur for the LH medication. And those medications you're going to be taking every single evening. Most patients need around 11 to 12 days of those medications before we're actually ready for the egg retrieval. And I know I've mentioned injections and shots, and I'm sure a lot of thoughts are going through your head, so I just want to also explain what those shots are and how exactly they're administered, just again to take away some of the anxiety or the unknown that kind of goes along with all of this. So I did bring an example here. So this is actually a Follistim pen, and what we'll show you during, actually even before you start the stimulation, you'll also meet with your IVF coordinator to go through videos on how to administer the medications, and you can also schedule a one-on-one appointment to go through this as well. But I also just wanted to show it here just to get a better idea of everything that's going to be going on. So this is one of the medications. It's called Follistim, so it's the FSH medication. And depending on your dose, there's a dial here that you'll twist to ultimately get your exact dosing for the medication. All of the medications are subcutaneous, meaning that they're all administered around the lower abdominal area. You're going to essentially lift up a little bit of skin. I'll just use my hand as an example. You're going to lift up a little bit of skin and then administer the injection. Of course, after cleaning it off with an alcohol swab. But I also just wanted to show you the size of the needle, just so you can get an idea that thankfully it's not a large needle. So let me just take off this protective sheath. So I'll kind of put it against my scrubs, but this is the full length of the needle right here that'll actually go into the abdominal skin. And so again, that's going to be every day. Most people need around 11 to 12 days. And also on your calendar, there'll already be appointments kind of listed in for where you're going to come back to the clinic for ultrasounds and blood work. The first ultrasound is after 4 nights of medications. Again, it's to get an idea in terms of how you're responding to the medication, checking in with our nurse practitioners in case you have any additional questions, and then we'll check your blood work so that we can see if you're responding well. Great. We get that idea from looking at the follicles, how many you have, and then also by looking at your estrogen levels. Sometimes we do have to increase the dose. Not bad. Again, why we're bringing you in, just to make sure that we're giving you the optimal dosing regimen to help ensure that we get a good number of eggs to grow. After that initial appointment, you'll then come in about every 2 days, again for ultrasound and blood work, see how you're responding to the medication, and ultimately to find out the day that we want to do what's called the trigger shots to get you ready for the egg retrieval. Behind the scenes, your primary doctor will also be reviewing the ultrasound and blood work results every day or every time you come in with the nurse practitioners. So we're all very involved in your care, even though you may not physically see us every time you come in. Once we get ready for the egg retrieval, what we're looking at is we want to see that the majority of the follicles are over 14 millimeters. At that point, we will then go on and say it's time for the trigger shots. Also sounds a little bit daunting, but really there are these 2 shots that we give you to help lead to the final maturation of the eggs and help the eggs separate from the follicular wall so that then we can go in and retrieve them with the egg retrieval. So it's usually 2 shots. They're called HCG or Pregnal or Novoril and Leuprolide acetate or Lupron. Again, what they're doing is leading to the final maturation of the eggs and helping them separate from the follicular wall. The HCG shot, it is an intramuscular shot, and so that one will also kind of do some teaching to let you know exactly where to administer the shot and how deep to actually place that needle. But it's usually around the buttocks area. If you think of wearing a pair of jeans and where that pocket, the top part of the pocket is, it's usually the general area that will have you administer that injection. The Lupron shot is a subcutaneous shot, and so that one will be like the Gonal and the Menopur, or the Follistim and the Menopur that you're taking. 36 hours after that, essentially 2 days after that, is when you have the egg retrieval. And we'll talk next about what that process is like.